Hi everyone, welcome back to the next video in our mini series on Ayurveda. And again, we have Vaidya Surya, who is the director of Healing Touch Ayurveda in Pune, India. He's an Ayurvedic practitioner. I'm so excited to have him here. Did I miss anything? Anything else on your introduction?
No, you haven't missed anything, Lauren. Thanks for such nice introduction.
And if you guys want to schedule a session with him, I will leave the email below. He has his own clinic. But today we are going to be talking about COVID-19. And I've been waiting to have this video. So Vaidya actually had COVID himself
Yes.
and fully recovered. So before we talk about like Ayurveda and COVID and prevention and treatment, I want to hear about your story and what your experience was like with COVID and when did that happen?
August 10th, one of my friend got COVID positive. So I just go to his home and met him to like how things are going to him, and I just prescribed some of medicine to him. So at that time I somehow I touched some of his like mug,
Oh
and I
no.
haven't remembered.
Oh no.
I
Was it
haven't.
chai? Did you touch his chai?
Yeah. Yes, it is kind of some kind of chai, or
I
we
knew
prepare
it.
some.
So basically chai gave you COVID. Oh no.
Yes, I got COVID from chai.
Worth it. Worth it. I'm so sorry. Go on.
So at that time, I haven't felt anything like I have not symptoms since 3 days. But on 14th of August, I got some of symptoms of like body ache and headache. But I was thinking that I am somehow tired about my work, or I was some kind of seasonal changes are there. But
Mhm.
that was not the case. It is
No.
something
Oh
else.
no.
After one day, like I also felt loss of smell and taste, like it is getting some serious stuff. I was thinking at that time, like I have now get tested for COVID. So I got tested positive for COVID, and that was a shock for me,
Yeah.
because
Wow.
because I wasn't thinking that I will get COVID, because I was taking all kind of precaution, like I was wearing mask and sanitizing my hand regularly. But I was not at that point, like I can think like how I got that COVID, like where I got that COVID. But somehow that thing clicked in my mind that I went to that friend home,
Mm-hmm.
and things get started from there.
Sure.
So on first day when I got tested, I also got high grade fever and body ache, full body ache with headache at
Mm-hmm.
that time. And after that I have weakness, lot of weakness in my whole body. So I was confirmed that I am COVID positive. So I just isolated myself from all over the friends and family. After that I got that news that I am going to have some kind of consultation with some doctor. But I delayed that. I was thinking that why not first use the thing I am practicing with lots of patient, like that was Ayurveda. So I
Mm-hmm.
started with Ayurvedic preparation. Like first main preparation was like warm water. Warm water, I started it regularly whole day. I was not consuming any kind of normal water. I was taking only warm water whole day. And second approach was that don't eat very much heavy food.
Mm-hmm.
Like I was avoiding bakery, I was avoiding meat, I was avoiding big source of protein like soya beans, like peanuts and all these things. I was taking very
Mm-hmm.
light meal, and most of time I was on empty stomach. but
Mhm.
it is not safe for most of patient. It depends on condition to condition. But I have some experience about that, so I was trying that. Like I am empty stomach most of the time. I was also taking some of the herbs, Ayurvedic herbs that I wanted to share. It is only applicable for my case, but
Mhm.
according to your condition, because COVID is a disease that every person is feeling some kind of different symptom. It is not same for all. Like some people having dysentery with fever, like some people have only smell loss or with fever, some people have only headache and fever. Like it is like a different combination in different people. So we have to analysis like how things are going, so it is not for everyone. I'm
Sure.
only sharing my experience that is depending upon my condition.
Mm.
So I was taking like guduchi, that is called Tinospora cordifolia. Various researches shows that it is very effective in viral fever, all kind
Mhm.
of viral fever. Like I was also taking ashwagandha tablet at 500 mg at BD with lukewarm water, and
Mhm.
with that I was also taking a one kind of decoction that is made up of tulsi, the dry ginger and black pepper powder. You can mix that to make a like a very hard decoction that will very hot in potency. So it will help in your detoxification also, and it will also reduce your fever like gradually. And one more thing, I was taking only one medicine, that is paracetamol, for my high grade fever. And I was not using any kind of modern medicine. I was taking proper sleep. I was eating khichdi whole time whenever I feel hungry. These thing I was taking regularly. So within 3 days, my temperature reduced, and my some kind of smell getting better and better. Like I'm able to smell all around, and I'm able to taste different things. At
Mhm.
that time when I was suffering from like peak of the COVID, I wasn't able to taste sweet or salty taste. Like if
Mm.
you give me a 1 tablespoon of spice in my tongue, I can feel that. It is like that.
Yeah, so after 3 days, you reduced your temperature. And
Hmm.
how long did it take until you were fully recovered?
It takes about 7 days.
Wow. And so you said this was all Ayurvedic medicine. What was the name of the
Yes.
last one? Was that like a Western medicine or was that an Ayurvedic medicine that you
Yes,
took?
it was only Western medicine, because some where it was like a deviation in my temperature. So I was
Uh-huh.
taking like one medicine,
Gotcha. Okay.
paracetamol.
Okay. So is it, and what does that one do? Is it like an antibiotic or it's to bring the fever down, like a painkiller, or what does that do
Yes, it is mainly used for fever only.
for fever? Okay.
Hmm.
Gotcha. Gotcha. So would you say overall you had a pretty mild case?
It is mild to severe. It is
Okay.
in between mild to severe when it started.
Okay.
But I started these modalities, Ayurvedic modalities. It reduces gradually. On 10th day, I am perfectly fine. And I also tested negative at that time.
Wow. So it seems like you beat it really quickly, and yeah, that's
Hmm.
incredible. So, okay, so thank you for sharing your story. I'm sorry that you had to experience that, but I think it just seems like at this rate, most people are probably going to experience it.
Yes.
Global pandemic. So you've got it out of the way. I haven't had it yet, luckily, very lucky. So, okay, so thank you for sharing your story. So we want to talk again, like more generally, how we can help anyone in the world with COVID, um, according to Ayurveda. So, is there anything else like the pathology of this disease that you want to talk about first to get people to understand like what it is in the Ayurvedic perspective on COVID?
So first
Mm,
of all, if we take a symptom of pain, like we
mm,
have headache, we have body ache. So in Ayurveda, it is said that there is no pain without vata. Vata is responsible for all kind of your pain. So
Okay.
if there is a imbalance of Vata in our body, so there is pain in our body, there is pain on our thinking also, and
Mm-hmm.
pain in our emotion also. If we
Mm-hmm.
are feeling any kind of emotional pain, so we can think about that there is some kind of imbalance of vata. So there is vitiation of vata, and fever. Fever is related to temperature, that is related to heat, and heat
Pitta.
in Ayurveda it is related to pitta.
Pitta. Yep.
Yes, you are right. Correct. So it is related to pitta. And loss of taste and smell, like there is some kind of obstruction in our sensory neurons, like when we are not able to find any taste or smell in any kind of food or any kind of material, it is related to obstruction. Obstruction is directly related to kapha because it is heavy in nature and cold in nature, so it can easily obstruct anything. And
Mm.
there is lots of patient also felt that they having some kind of breathing issue or some kind of blockage in their lungs. So
Like kapha.
it is due to kapha. So these all three doshas hand on hand give you COVID virus in broad, like we can
Mm.
say when in modern terms. But in
Mm-hmm.
Ayurvedic, we will dissect that COVID virus into doshas.
Mm-hmm. Okay.
Hmm.
Yeah, that makes so much sense. And this is again why I am so attracted to Ayurveda and love Ayurveda, because it explains everything, every disease, but in very, how do I say it? Very simple, like just very simple and intuitive terms. And like once you understand the Vata, Pitta, Kapha, and like we're going to make more videos going into the very basics. We talked about it a little in the last one, but like everything and every disease really comes down to the imbalance of vata, pitta, or kapha. So that's very interesting. Like I've learned a lot about individual imbalances, like for example, like just vata, like the kinds of diseases that come with just vata. So this is interesting. So you're saying it's an imbalance of all the three.
Firstly, there is a low end displacement of Agni, like digestive fire in your belly.
Mm-hmm.
Like your digestive fire get low and it got displaced from its place
Mm-hmm.
due to whatever things we are consuming. If we are consuming like wrong kind of foods, wrong kind of we are not getting proper kind of sleep, we are not having proper kind of exercises, we are very much tensed, it all combinedly gets and lowers our digestive fire, and it also displays our digestive fire, that result into accumulation of ama, that is toxin in
Mm-hmm.
our stomach. And that toxin goes with vata and blocks all the sweat channels of whole our body. So the displaced digestive fire goes on surface of our body and it generated heat. So that's how we feel temperature. It is the
Wow.
mechanism of temperature.
So, you said it goes like on the surface of our body. Do you mean on our skin? Like the ama is actually on our skin, or did you mean something else?
Yes, ama and agni is on our skin, but due to blockage of our sweat channels,
Uh-huh.
blocks our sweat channels, and there is beneath that there is agni, the
Uh,
displaced agni that has to be in our stomach, but due to improper exercise, improper sleep, improper food, it
uh-huh.
got low and displaced from stomach, and it goes to in our surface, and it got blocked
Okay.
due to ama,
Okay, I didn't
that
know that.
toxin.
I did, so
Hmm.
I know like Agni is the term like digestive fire, like in our digestive system. Um, but I didn't know that like you said like the Agni can actually then be removed from the digestive system and like travel into other parts of the body. Um,
Yes,
so then okay, so that's what causes the fever then? Is that what that is what causes the fever?
yes, yes.
And then so what is the body trying to do like when you have the fever? Is trying to balance it? Like what exactly is happening?
Yes, it is trying to balance that. It is trying to, like, if you see fever in modern terms, it is
Uh-huh.
trying to kill the bacteria and viruses that are in your system. It is
Yeah.
increasing your temperature, so so it can create some kind of heat and kill
Mm-hmm.
bacteria and virus that are in. It is kind of protective system in our body. But in Ayurveda, it is kind of a disease, or it can be as a treated as a symptom. So
Mm-hmm.
it is kind of different in Ayurveda.
Yeah, so it's like just again another example of, as long as you have this healthy digestive fire, the
Hmm.
healthy Agni, and your Vata Pitta Kapha are imbalanced, like this thing won't happen to you.
Yes, and there is one more point I want to share, that modern medicine is too much focused on external thing that is coming to our body, and
Mm-hmm.
Ayurveda that is focused on individual, like
Mm-hmm.
how I fight with that external thing.
Mm-hmm.
They are not
Yeah.
concerned about too much about external thing. They are more concerned about like individual.
Mm-hmm. Yes. So modern medicine or Western medicine is like, okay, you're a person and here's a disease. Let me give you this general medicine. And they give everyone the same medicine or the same prescription to
Mhm.
try to kill whatever from the outside.
Mhm. Yes.
But they're not focusing on actually treating the individual, and actually getting to the root cause, which is you
Mhm.
have to release the ama, right? You have to get the ama out of the body. You have to bring the vata pitta kapha into balance, and you have to heal that agni, the digestive fire. You have to look at the body as a whole and balance it. So again, why I love Ayurveda. So, but that also, that makes, okay, so we're seeing this. So COVID, like you said, we break it apart into vata, pitta, kapha, and
Mhm.
that also then explains why people are having different experiences with COVID, right? Like it
Yes.
seems then intuitively, then whatever imbalances they already had. So maybe this person's vata was very aggravated, this person's kapha was very aggravated. They are going to get the same COVID, but based on their imbalances, they're going to experience it different based on what was already imbalanced. Is that right?
Exactly. I want to also share one more case. Like there was a 75-year male patient I was treating last month. So he is having only fever, headache, and like dysentery. Like he is having like too much of loose motion. So I assess his Prakriti. So his Prakriti was like Pitta and Vata.
Mm-hmm.
So
Mm-hmm.
generally, Pitta kind of people have like very much, they are not tolerated with too much of spicy and harsh kind of food.
Mm-hmm.
So he was, before that, he was eating like too much of meat, too much of
Mm-hmm.
dairy product, too much of like this kind of thing. So when COVID attack him, so like it has mechanism on his Pitta.
Mm-hmm.
So he is having like dysentery kind of thing. He is having like a pain, and pain is related to directly to vata. So he is having pain
Mm-hmm.
also, and fever
Yes.
with pitta.
Okay. So, and
That's
again,
how I explain this.
your prakruti is what you're born with, right? It's your, at the time of conception, you
Mm-hmm.
have a certain constitution, which means it's your balance of vata, pitta, or kapha. Okay, so
Yes.
this guy was mainly pitta, secondarily vata, which is also what I am. So if I get COVID, then I will have similar things. So the way you experience COVID is based on your prakruti, your
Mm-hmm.
birth balance, and then also your vikruti, right? Which is,
Mm-hmm.
am I saying it right? Vikruti or Vikriti?
Yes, it's correct. It's Vikruti. You are correct.
Vikruti, which is then your imbalances in vata, pitta, kapha.
Mm-hmm.
Um, Yes, this is, God, it's so intuitive. It makes so much sense. Um,
Mm-hmm.
so okay. then so from the pathology or like from understanding it from Ayurvedic terms, was there anything else that we need to teach people, or can we move on to the next topic? Do you want to talk about treating COVID next, or do you want to talk about how we can prevent COVID?
I want to like more focused on like how we can prevent COVID, because in treating kind of thing, like we have to first assess the prakriti of that person, like what symptom he is having, and according to that we have like different kind of medicine. So,
Sure.
but I will also tell you some of the herbs you can use in journal. Like it
Okay.
will work on all prakriti and all kind types of COVID. So I will give more emphasis on like how we can prevent COVID.
Okay. And that's again why I love Ayurveda, because it focuses on prevention, right? That's the main
Yes.
thing, is we want to keep you healthy your whole life, and we want to prevent diseases from happening. Unlike Western
Hmm.
medicine, which you go to your doctor and after you already have some sort of thing, then they're going to say, okay, you have this, you have this. Now we're just going to give you a medicine to cover up the symptoms. Okay, so, and then not actually focus on the root cause, which is Agni, Ama, Vata, Pitta, Kapha, how to balance these things. Okay, so we're going to focus on preventing disease and keeping balance in the
Hmm.
body. Amazing. So how do we do that with Ayurveda? How do we boost our immunity? How do we stay in balance? Because like I said, COVID is spreading. Likely most people are going to experience it over the next few years or so. So how can you help to prevent this thing?
So before that, I want to share a concept of immunity in Ayurvedic aspect.
Okay,
So first of all, I wanted to share like what is immunity according to Ayurveda. It
awesome.
is in Ayurvedic term. It is said like Vyadhi Shamat. It is said Vyadhi. Vyadhi means disease. Shamattu means like it has our body has like combating power. Is indigenous combating power. So we have immunity according to Ayurveda. Like there is two kind of immunity. One is physical immunity and one is mental immunity. You will not find any reference in modern medicine of mental immunity. It is
No.
only described in Ayurveda.
Wow, okay. Just the more and more I learn about Ayurveda, the more and more I fall in love with it, because it takes into account your mental, right? The mental
Hmm.
aspects, your emotions, and it looks at you as a whole. So that's amazing. I love it. Okay, continue.
So a few things that can reduce your immunity, like when you are suppressing your natural urges, like when you feel like you have to urine, like when you have to pass your stool, like when you have
Hmm.
like some kind of coughing reflex, some kind of vomiting reflex. If you are
Hmm.
stopping them, it will
Hmm.
ultimately suppress your immunity, suppress your combating fight with viruses and bacteria.
Hmm. Yeah,
So
so
we have to,
never stop those natural urges. Yes, I learned
yes.
that. So, but we're also talking about burping and farting, passing gas, going to the bathroom, coughing. Okay, so it's very unhealthy to contain those things.
Mhm. And the main one more thing that Ayurveda described, that if you are not taking proper kind of sleep, you are
Mm,
awake in your whole night. You are not sleeping at right time, and you are not waking up at right time. It also suppresses your immunity.
mm, mm-hmm. So I know we talked about this in our last video, that obviously according to
Yes.
someone's job and their schedule, like the actual timing of their sleep will vary.
Hmm.
But so like, what does Ayurveda describe as a quality night's sleep?
Like some people say like you have to sleep 8 to 10 hours a day. Some people say like you have to sleep 6 hours a day. But Ayurveda more focuses like how deep is your sleep. Like if you are
Mm-hmm.
sleeping like only 2 or 3 hours, was it that quality sleep? Was it that deep? So Ayurveda focuses
Mm-hmm.
like how deep sleep you are taking. But in general, you can take 6 hours of sleep in minimum.
Minimum. Okay. I'm looking at quality sleep. Okay, awesome. So for immunity, do not suppress your natural urges. Get quality sleep. What else?
And one more, exercise in a proper way. Less exercise and excessive exercise both can lead you to suppression of your immunity. So you have to take care of your body by doing exercise in a proper way, like in moderation.
Mm-hmm. And so the type
So
of exercise and the amount of exercise you do, that also, I mean, we can suggest generally, but that also depends on your prakruti, right? And your constitution and like your vikruti or imbalances. So for example, if someone was to take a consultation with you and they were, to get an assessment with you, but then you could advise them like specifically on their body type and their imbalances, what would be proper exercise for them, for their body, right? Like that's very
exactly.
individualized too. Okay, yeah.
But people who cannot do that kind of exercises or harsh exercises, there is a method Ayurveda describe for all kind of prakriti and all kind of people. It is said like Ardh Shakti Vyayam. It is made up of Ardh means half, Shakti means strength, Vyayam means exercise. Half strength exercise, like whatever strength you have, you have capacity to eat 4 chapatis or 4 bread, you will eat only 2 bread. You
Mm-hmm.
will not eat full stomach. It is
Mm-hmm.
same for exercise. If you have capacity to run 1 kilometer, you will not run full 1 kilometer, you will run only 500 meter. If you
Awesome.
are doing 50 push-up on your peak, you will do only 25 push-up. So it will
Mm-hmm.
on in moderation, it will not surpasses your limit, and it is not below your limits. It is on moderation. So it is the
Mm-hmm.
proper way that Ayurveda describe how we should exercise.
Awesome. And we mentioned this in our last video, but the
Hmm.
consistency is the key. So just doing little, little, little every day to your half strength
Hmm.
is perfect. Not under exercising, like, okay, I'm going to exercise once a week. No, the body needs movement, and not over exercising. I think even honestly, the word exercise in a way has some negative like, I don't know. It can seem a little negative because that feels like, oh, I have to overexert or I have to make my body look a perfect way. And there's just, we learn exercise mainly as a way to lose weight. We learn exercise
Hmm.
mainly as this way to um, get our bodies in this perfect ideal state. But I like to think of it just as movement, right? Like your body needs to move every single day. It can move and it can
Hmm.
be something that you enjoy. It can be walking, it could be running, it could be dancing, it could be yoga. But your body needs to move to be healthy. So I like to think of that like a little bit of movement every day to your half strength.
Exactly. And one more very interesting thing that Ayurveda described that can reduce your immunity is the mental stress.
Oh my God.
If you
Yeah.
are too much, if you
I
are
think this is
taking
going to be me. Sorry, go on.
if you are taking too much of stress, if you are too much angry, if you are too much having fear, if you are too much having envy, these all mental gunas accumulate and causes a suppressing of immunity. So we have to also think about that, and we have to filter all these qualities of ours.
Wow. So we've shared a little bit about immunity, and some of the things according to Ayurveda that weaken your immunity. So we talked about
So
like the four
I
main
will
ones. Are there
also,
anything else?
yes, I will now share what we can do for improving our immunity. Firstly, we
Okay.
have discussed how these things weaken our immunity. Now we will discuss what thing will improve our immunity.
Mm.
First thing is there are 3 pillars of Ayurveda. Main 3 pillars of Ayurveda that will help in your healthy life. Firstly is your food. Like we have discussed about food in our last video.
Mm-hmm.
It should be light, it should be consumed in a proper way, it should be like we have to smell, and we have to be like indulge in like eating. We
Mm-hmm.
uh, Now we are seeing that people are watching some kind of series on their phones or tablet or TV, so they are not fully concentrated on what they are eating and how
Mm-hmm.
they are eating. Like some of individuals are angry, or some of individuals are really sad, they eat and eat, they don't know like what they are having in their hand.
Mm-hmm.
So we have to like conscious about our eating. And second pillar of Ayurveda is our sleep. Like we have discussed, we have to sleep like at least 6 hours a day, and it should be very deep sleep. The
Mm-hmm.
quality doesn't matter, the quantity doesn't matter, quality matters according to Ayurveda. And one more thing, celibacy, that is called brahmacharya. We have to practice we have to practice that also. Like we have to maintain some period of time, like we are not indulging in sexual activities
Mm-hmm.
time to time. Like we have to practice celibacy time to time.
Okay,
It is not
so
like strictly done.
I'm really curious about this. So
Mhm.
then, so according to Ayurveda, so again, you can overdo things. So I guess
Mhm.
like I want to know like the exact. So what is like a healthy amount? So if you have a partner, like say in 1 week, then what is like the healthy amount of times to have sex in 1 week?
Actually, it is very individual kind of thing. If you having like that kind
Mm-hmm.
of sperm or ovum kind of thing, like you can do once in a week. And
Mm-hmm.
according to individual who are not efficiently can do once in a week, they have to do 15, 15 in a 15 days. Some people don't have that capacity, they will do once in a month. Like it depends on individual to individual, like
Mm-hmm.
how they should maintain their celibacy period. We will
Mm.
definitely discuss in a separate video. It is a very interesting topic.
Yeah, okay. Yeah, let's make a separate video. I'm very curious. But the overall message is to have some period of time of celibacy and to rest and let the body restore. Okay.
Yes.
So food, sleep, celibacy. Um,
Hmm.
anything else?
Yes, there is a concept called Sadvritta. Sadvritta in Ayurveda. Sadvritta means good conduct.
Okay.
Like you have to follow a good conduct. Good conduct not only means like you have to talk in a certain like gentle way or some kind of way. It is also a piece of our mind. Like we have to think good about other self. Like we, if we are talking very sweet and we are thinking negative about that person, that will
Mm-hmm.
ultimately harms ourself. So
Mm-hmm.
it is called sadvritta, good conduct. Good conduct not only with other people, with ourselves. Like usually what we are doing right now, we are somewhere comparing ourselves with some kind of individual. Like we are always accuse ourselves for all the mistakes that are in our life. So
Mm-hmm.
it is not good conduct for ourselves. So we have
Mm-hmm.
to maintain good conduct with ourselves and with external world also.
Mm-hmm. Okay, let's make another video on this. I'm gonna have to make a list of like all the videos because
Mhm.
yeah, so good conduct in general is the combination of the things you are saying and talking about um, other people and yourself, as well as what's going on up here. So
Yes.
cultivating a healthy mind, healthy positive thoughts, as well as healthy things that you're saying about the world. So, okay, again, love Ayurveda because it looks at everything. Obviously, you can be exercising, you can be sleeping,
Mhm.
you can be eating well, but if you're constantly in a negative frame of mind, like, oh, I hate this, my life sucks, that person's out to get me, da da da, I'm so fat, or I'm gonna get so sick, like, if you're constantly thinking that, you're not
Mhm.
going to be healthy. We have to look at the mind
Yes.
too. Okay,
Mhm.
okay.
There we can use also rasayan like rejuvenating therapies. like that we can say rasayan, like we can consume chawanprash. Most of
Mm-hmm.
people have heard about that chawanprash, like they can consume some amount of amla
Mm-hmm.
in their daily routine. They have to consume like ghee in their daily routine. It will also help their in immunity like gradually.
Mm-hmm. Okay, so in general, for boosting immunity, amla, which I think we said like a powder is the best way to generally to take herbs rather than a little tablet is like some powder and
Yes.
water. So amla powder, tivanaprash, and ghee. Okay.
Yes, it should be in our like daily routine, like we have to consume like 4 or 5 times a week these
Mm-hmm.
things.
And again, these so amla, chavanaprash, ghee are healthy, for any body type, right?
Yes, yes, in general they work in all kind of body types, and they are like pacify all the three dosas.
Mm-hmm. Okay, so we
They
talked
work on
about
all the three dosas.
okay, so we talked about healthy food, healthy eating, quality sleep, periods of celibacy, um, thinking of good conduct, being aware of the things you're saying, the things you're thinking, creating a healthy mindset, um, and throughout your week, taking amla, shavanaprash, and ghee. So, and we could make separate videos, I think, on all of these things, but in general, these are how we can help to boost our immunity, according to
Yes.
Ayurveda. So let's say you do, unfortunately, get COVID. Um,
Mhm.
so I think a lot of people are going to go to Western medicine first. And
Mhm.
even you took some tablet for your fever, and that's totally okay.
Mhm.
Um,
Mhm.
I want to be able to provide people with things they can do, because they'll likely do Western medicine in conjunction with Ayurvedic medicine. So
Mhm.
let's talk about this. So say, okay, you're diagnosed and you're taking some Western medicine. Could they also like come to you for a consultation, or if they know an Ayurvedic practitioner, like they should get a consultation, right? So that they can get specific things for their body.
Yes, actually, the thing is happening that almost 99.9% of individuals are in modern kind of mindset. They are mostly taking modern medicine, but only like 1 or 2% of people who are interested in like Ayurveda also. So I
Mm-hmm.
was working with like 30 to 40 patients. They all are taking mostly modern medicine. But
Mm-hmm.
with that, I am also giving them some kind of Ayurvedic medicine according to their clinical condition.
Mm-hmm.
So it is not like that I am going to stop there all the modern medicine and I will only give Ayurvedic medicine, but according to their severity and condition. Like some of my patient are of 80 years and they
Mm-hmm.
are in like very critical condition. They are in like emergency room, so they
Mm-hmm.
having all the ventilators in their body, and they are like having on oxygen support, and there are
Mm-hmm.
lots of modern things are going on them. So I am
Mm-hmm.
also working with these kind of patients. So we are somewhere using like integrated kind of approach, like where modern cannot work properly, Ayurveda work, where Ayurveda stop and their modern can work properly. So
Mm-hmm.
in critical patient, we are using like combination therapies
Mm-hmm.
by their expert doctor. I am not giving any kind of modern medicine to them. I am only giving like Ayurvedic medicine, Ayurvedic consultancy according to their clinical condition. But firstly,
Mm-hmm.
we have to assess like what is your prakriti, what symptom you are having right now. Like you having dysentery, you having headache, like you having very high grade of fever, you having like loss of sensation.
Mm-hmm.
So if we assess these things according to that, I can tell like what herbs you can take, what what are the like rituals you can follow for your
Mm-hmm.
fast recovery.
Mm-hmm.
But
Amazing.
some
Okay,
of,
so it's very
yes,
special or very individualized.
yes, but some of things I wanted to share, like everyone can take, every prakriti people can take, uh, they can they can take like 1 glass of milk with 1.5 spoon of like 1/4 teaspoon of turmeric powder in that. People, I'm
Warm milk. Warm
warm
milk. It has to
warm milk.
be, and is microwaving it okay, or does it need to be boiled on the stove?
Boiled on the stove will be perfect. So they can take at bedtime. And all these remedies are only for like um mild to moderate kind of patient,
Okay.
not for severe patient. So they can take ashwagandha like in powder form or in tablet form, like 500 mg, two tablet twice a day
500 mg tablets, two 500 milligram tablets twice a day
with lukewarm water
with lukewarm water. Okay,
after
so
meals.
after meals. Okay, so
Yes.
1,000 milligrams of ashwagandha twice a day
Mhm.
in lukewarm water after meals. Okay.
Yes, and they can, as I told you, like they can make a decoction of tulsi, dry ginger, and black pepper powder. Like they can take for one person. I'm telling you, they can take like three to. Will you get tulsi leaves there in USA?
It's a little rare. I've even gone to an
Mhm.
Indian store and they didn't have
Mhm.
it. So I think you can find it some places, but
So, will
I'm
you
not
get some
sure.
kind of powder or tablet of tulsi?
Yeah, I've seen it in teas. You can probably find a Tulsi powder. Yeah,
Mhm.
so they can
So,
use the
so
powder
you
instead.
can, yes, you can use powder like you can mix one full spoon of like 5 gram spoon of tulsi powder, one full 5 gram spoon of dry ginger powder, and one full spoon of black pepper powder. You can
Wow.
store that 15 gram of mixture in like one for like 2 3 days.
Mm-hmm. Okay,
You
so
can
okay.
you can just add 3 gram of that mixture in 1 cup of warm water.
It's probably gonna taste kind of nasty, right? People have to,
Yes.
it's not gonna taste good, but it's gonna help you.
No
So
medicine taste very nice.
yeah, medicine doesn't taste good. So equal parts Tulsi powder, ginger, black pepper, mix it up into a container so you can have it ready. And then each day just take like a small spoonful, mix it in some lukewarm water and drink that.
Yes.
Okay.
Mhm.
Okay. Awesome.
They can also take like people who got tested negative after being positive. They can take they feel some kind of weakness after the recovery, so they can take like 1 tablespoon of chawanprash with warm water or with warm milk,
Okay.
empty stomach at morning for their faster recovery. It has like amla. The main constituent of chawanprash is amla.
Um, okay.
It is
So
rich in vitamin C and iron.
oh, okay. So, and these things you can either go to an Indian grocery store and find it if you have one nearby, or you can order them online. Um, and I will say one company that I really like is Banyan Botanicals. I'll link to it below.
Mhm.
And all of their stuff is organic because
Mhm.
unfortunately, most of these herbs are very common in India, but in other parts of the world, they're not yet
They are-
common.
Yes.
So yeah, it may be a little difficult to find them, but you can find them.
So these all stuff are for only a mild to moderate kind of symptom. Who having mild of moderate kind of symptom. These are only for them, not for severe
Okay.
symptom patient.
Okay. Is there anything you recommend for a severe patient, or at that point they would need to come for consultation? Or
Yes, the severe patient are very much we approach severe patient with very much of individualistic approach. Like
okay,
we cannot say, it is very critical thing, so we cannot say anything at that
sure.
point of time. It is
Okay,
very unpredictable, like I will suggest anything to them.
okay, sure. Okay, so we talked about then in general herbs. Shall we talk about then in general other diet and lifestyle things you can do if you get COVID?
Yes, one of the things that they can do is pranayama, because this virus mainly attacks on our breathing system and our lungs. So we
Okay.
have to make our lungs in preventive thing, like we have to make our lungs very much strong, so it cannot do that kind of damage to our lungs.
Mm-hmm. What kind of
So we have
pranayama?
to we can practice like anulom vilom, like
Mm-hmm.
we have to close one of our nostril and we breathe and hold a bit and close the other part of nose and passes the air from that part. So we have to do like alternate kind of breathing, and we will now take breath from that nose, opposite nose, and hold that, and now close that nose and passes the air from other side. Like again we
Okay,
have to repeat this.
I
We
have a
can do this.
video. I have a video on this where I teach you how to do it, so I'll link that below. How many sets and how many minutes long should they do that?
uh, in general we suggest patient like for if they don't have any kind of clinical condition, they can do it, they can start with 10 minutes. But if
Mm-hmm.
they are having covid, they are recovering from that phase, so they can do only for 5 minutes. And they can also do like 10 set of 10 repetition and 3 set of deep breathing. Like they have to inhale breath and hold a bit and exhale.
Okay. I also have a video on that. I know it sounds very
Hmm.
simple, but I have like a quick
Hmm.
5-minute tutorial on how to do deep breathing too. So I will link
Hmm.
that as well. How many minutes of deep breathing do you suggest?
In starting, they can do like 3 minutes, and gradually they can increase according to their capacity. For dietary type, they can go for like moong dal khichdi. They can eat
Mm-hmm.
like very, it is very,
My favorite.
it is one of the like famous Ayurvedic recipe all around the globe, moong dal khichdi.
Mm-hmm.
And because it
Okay.
is very effective and easy to make, and all the ingredients you will get anywhere in the world, so
Mm-hmm.
that's why it is so much famous.
Okay,
So you
so
can
I'll link below to a recipe for khichdi as well. Okay, what
and
else? What other dietary things?
I as I told you earlier that in preventive and those who have like suffering from covid, they both can take golden milk, that is like warm milk with half or 1/4 spoon of turmeric in that.
Mm-hmm.
So it is
Mm-hmm.
for both people, and they can take it.
Khichdi, golden milk, what else?
They have to take like we if you are a vegetarian or if you are a
Mm-hmm.
vegan, I am not suggesting you that. But if you are a non-vegetarian, you can take like chicken soup or some kind of soup in your like if you are vegan or vegetarian, you can take vegetable soup in your
Okay.
regular routine.
Anything
these
else?
these these dietary things you can definitely add. And the I would not recommend everyone to practice that, but I have seen that people who practice like some kind of fasting during their fever peaks, it really helps them.
Mm-hmm.
Like if they are eating like 8 hours cycle, it really it really help to recover them fast.
Mm-hmm.
because
So eating
because
every 8 hours.
8 hourly.
Mm-hmm.
Because in Ayurveda it is said that langhana means like you are delaying your eating, or you are increasing your digestive fire, because you are not putting something in on that fire, so it is like
Mm-hmm.
burning slowly, slowly, slowly.
Mm-hmm. Okay, so I think so if someone wanted um, personalized recommendations on
Hmm.
fasting,
But
I think
it
they
is very
should go.
individualistic.
Yeah,
It is very individualistic. I'm not suggesting everyone
yeah.
or anyone to practice that.
Mm-hmm. Yeah, they would need to come for a consultation and do fasting under the guidance of a doctor.
Yes.
Okay. Okay, awesome. Anything else?
And one more thing, like it is very normal kind of thing that I will tell. Like don't eat spicy food, don't eat bakery, don't eat like very much of meat, red meat. So these all things they can avoid. In place of
Um,
that, if they are non-vegetarian, they can take some kind of soup of that, like according to their preference.
And when they are consuming water, right, they need lots of water, but it should be warm water or hot water, right? Like we don't want to be drinking cold and icy things.
Yes, any kind of cold and icy things or water is avoided.
Mm-hmm.
They
Yeah.
they only have to consume warm water all the day long.
Mm-hmm. Okay, here's a question because I love my chai so much. If you get COVID, can you still have chai, like your Indian chai? Can you still consume that? Is it safe?
Yes, it is safe.
Okay,
It is
that
perfectly
is
safe.
great.
You can take chai without any like tension.
Okay, thank God. Oh man, I think that would hurt me more than anything not to have chai every day. Okay. Oh
And I
man,
also
okay.
wanted to share that when I was suffering from that phase, I was taking chai.
Okay,
Chai.
so we're good. Cool. Cool. I want to make a video on how to make proper Indian chai because if y'all haven't had proper chai boiled on the stove with the spices, you haven't had chai. So,
Mhm.
okay, any last advice or closing thoughts?
Yes, just it is like everyone is fearing from that virus. Like everyone is very much concerned that how things go. Some of have suffered from financial losses. Some of they have suffered from like their businesses are hampered. Some of
Mm-hmm.
have their like family members are not there with them, so there are a lot of things happens, and lot of people have suffered from that virus. But I just wanted to say and share with them, like just stay safe, and don't take that virus very lightly. Like it is serious. Like I have
Mm-hmm.
seen patient being on like very critical condition in hospitals, like
Mm-hmm.
they can't even breathe. They are like there is very critical condition uh, everyone will face if they don't take that virus very seriously.
Mm-hmm. And so, yeah,
So
so I
take
think
that seriously.
by taking it seriously, what you can do today is start doing the preventative measures that we've talked about,
Exactly.
right? You can start doing that right now, like right after you get off of this call. You can go
Mhm.
do some pranayama, get your ingredients for your khichdi. Um, buy some of the herbs that we suggested, like Chavanaprash, Amla, go buy some ghee. So there's things you can start doing right now for you and for your family to help
Yes.
boost your immunity to prevent it. And I would definitely encourage you. I know there'll be people watching here who maybe are just hearing about Ayurveda for the first time, but definitely I would encourage you, like, even if you or someone in your family is getting Western medicine treatment, start to incorporate some of the things that we've mentioned. Like it can only help you. Like these things are very
Yes.
healthy. It can only help you. Um,
Mhm.
I definitely encourage you to do the integrative thing and try both together. So yeah, so
Yes.
I hope that these tips helped you guys. Yeah, this is really a scary time in the world right now, and like
Mhm.
our mission is we want to help people. We want to give
Yes.
them this education so that you can take your health into your own hands. If you want, if you want to get an individualized assessment, you can schedule an appointment. I'll leave the link below with Vaidya and his clinic. But yeah, we just want you guys to be healthy. We want you guys to be safe and empower you so that you have lots of tools. You and your family have lots of tools to get healthy during this thing.
We will definitely come back with some of our upcoming topic
Mm-hmm. Yeah.
that will
So
definitely add some value to our viewers.
yeah. So we just today we mentioned lots of videos that we want to talk
Mhm.
about. So yeah, just stay tuned. We're gonna have lots more videos. Next week I'm really excited for this one. So we are going to be talking about beauty topics, and we're going to be talking about hair and skin. And Vaidya has pulled a lot of this information from the ancient texts in India and is pulling it all together. So do you want to just really briefly give them a preview of what we'll be covering in our next video?
Yes, definitely. Most of people know about beauty and hair, like they know about skin, they know about hair, but in modern perspective. But how Ayurveda think about skin, but how Ayurveda think about your hair. I will disclose all these like quotes from various classics from Ayurveda, like how our ancient acharyas, how our ancient scientists think about our skin, our hair, how we can keep them healthy by using some of only simple things that are all around us. We can just incorporate in our daily routine, and we can see changes in our skin and in our hair like in few months, and that will be like a very miraculous changes. So I
Wow.
will all disclose these things in our next episode.
Okay, well, I'm very excited to learn too. I'm very excited and cool. Okay, so thank you so much, guys, for tuning in. Please like this video, please subscribe, please share it. It really helps the channel. And again, our mission is to empower you and to teach you and to spread the true knowledge of yoga and Ayurveda around the world. And please engage with us, comment below like what you learned, or if you have any questions as well about COVID and Ayurveda, please drop us a question below. We love engaging and hearing from you guys.
Yes. If you having any question or if you having any queries, you can drop your comments below. We will definitely look them, and we will answer them in our next video. And please like our video and subscribe our video. We are not charging anything for this knowledge. You have to just support by liking and commenting and sharing, and by
Mm-hmm.
subscribing us.
Yes, thank you. And let us know what other topics you want to hear about. We have a lot of videos coming up. We have a lot of cool things coming up. Do you want to tell them what you're doing in December as well? We have something exciting coming up at your clinic.
Yes, it is some surprise I will disclose in December. I will
Okay.
disclose in our next video.
Okay. So we have a surprise for you guys. Okay.
Hmm.
Cool. I'm excited. All right. Thank you, everyone, for tuning in.